Occupational English Test. Practice Test 5. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Mariah Cobin. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Coben. My name is Dr. Blunt. I'm one of the doctors here. How can I help you today?
There are many things I'd like to discuss with you if I can, Doctor. I think the first thing I'd like to discuss is this persistent sort of gnawing pain that I've had in my tummy for a long while. It happens in spells and lasts for a few hours at a time. It's really quite unbearable.
I'm sorry to hear that. It's quite strange that the pain is sharp and lasts for so long each spell. Are you sure?
Pretty sure. It's really very different from the burning sensation I feel because that feeling comes and goes. It's kind of fleeting, if that's a thing. Can you have fleeting pain?
I'll note that down that that's what you feel.
Thank you. I was pregnant earlier this year, but lost the baby and wonder whether that could be connected somehow. The trauma, I mean.
We can't rule it out for certain right now. I wouldn't want to comment until the test results come back. Right now, there are 2 separate, potentially connected, but also potentially wholly unconnected pains happening right now. Have you noticed that anything triggers them, or is it entirely random?
I'm not sure what brings it on, no. But I do find that when I eat really greasy food, it makes everything worse. Not that I do that very often, but when I do have a burger or a kebab from the local, it does tend to flare up. The really, really strange thing, however, is that I've lost quite a bit of weight recently. The even weirder thing is, it's made me not want to eat anything at all, like my appetite has completely gone downhill.
How long have you noticed this?
Oh, at least 6 weeks, if not more. I know that because I wrote it down in my journal as soon as I noticed something strange was going on.
Okay, it looks as though we will need to do some tests. Particularly a fecal analysis, and in particular, a fecal occult blood test.
Oh, does that mean that I have to give a sample?
Will that be a problem?
Well, I'm a little embarrassed to say that I've noticed that I've been passing quite dark, stools recently that have worried me somewhat. I'm sorry, I'm being childish. I guess that's what all of this is for, to give us some answers, right?
There's nothing childish about wanting answers, Mrs. Coben. I'm more than happy to help. We deal with these sorts of conditions every day, and I've been doing this for 16 years. There's very little we haven't seen by now, so please don't worry about that.
Can I worry about something else?
That depends on what it is, and whether I can do anything about it or not. Will you share what's on your mind?
I told you that I've been struggling to keep food down, but it's more than that. When I throw up, I think I can see blood in my vomit.
Thank you for sharing. There is a connection there, and if you have what I think you do, I'm confident that we can provide treatment quite quickly.
What do you think it is?
Have you ever heard of a peptic ulcer?
Funnily enough, yes. Recently my sister got one. They said it was caused by bacteria.
Helicobacter pylori, probably. That little terror's been infecting people all over the place. Everyone's dropping like flies around here. It's a nasty one.
Extract 2. Questions 13 to 24. You hear a pharmacist talking to a patient. Alan Jenner. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hey, you're that man from the news, aren't you? Mr. Alan Jenner?
That's me, but right now, I'm that 50-year-old bloke who needs his meds.
Gotcha. Let's take a look at that prescription. So, it's for your headaches, is that right?
Yes, it is. I've got searing pain on the left side of my head that's hard to shake. It comes and goes in what I'm calling episodes, and I can really feel the pain, especially around my eyes. Take a look at them. They're all red and watery.
Yes, I'm afraid I have to agree with that. What a bummer. You know, you've been prescribed with a pretty strong drug. Are you taking anything else? Because I wouldn't recommend taking more than one set of pills at any one time.
I did try some paracetamol that I bought over the counter here a while back, but it didn't work. That's why I went to see my physician, because this thing is interfering with my work. Do you know how hard it is to deal with television when you feel like you're going to explode? The bright lights, the makeup artists, the voices in your ear, the teleprompters. It's a living nightmare. When I saw my doctor, she wanted to prescribe me with something strong. Would you say that this is the most powerful painkiller available?
Well, Zomotriptan is pretty strong, although the injection is more powerful than this nasal spray. How come your doctor chose the nose delivery route?
Because I can't stand needles ever since I was a child. Come anywhere near me with one and you'll see a changed man, I'll tell you that. I blame my school nurse. She was a savage, and any shots she needed to give were done in a kind of stabbing motion. Ugh, gives me shivers just to think about it.
Wow. All right. Well, this is the one. Each time is a dose of 5 milligrams. So just squirt one into one of your nostrils, okay?
Understood. And if it's not working right away?
It usually takes about 2 hours to kick in. Otherwise, you can take another 5 milligram squirt after that time. Always leave those couple of hours between the doses, though. Otherwise, this is medication that can be pretty much taken as required.
It says here that the max dosage is 10 mg per day. So that's what? As required, but no more than twice a day?
Correct.
Thank you.
I'm sure your doctor checked this before letting you go, but I can't let you go with this without doing my checks, so we don't lose our license. Again, for the record, are you taking any other medications?
No, I'm not.
And have you been diagnosed with any heart conditions like ischemic heart disease or hypertension?
No, I haven't.
All right, you're good to go. If you just take these to the counter, we'll total these up for you.
That is the end of Part A. You now have 2 minutes to check your work. Part B. In this part of the test, there are 6 short extracts relating to the work of health professionals. For questions 25 to 30, choose answer A, B, or C, which you think best fits according to what you hear. Question 25. You hear a doctor talking to his patient about a broken arm. Now read the question.
I'm afraid that your suspicions are correct. There does seem to be a fracture here. I'm sorry I don't have better news.
No, please don't be sorry, Doctor. It's not your fault that I tripped at work. It's my colleagues for putting a spade in the way. The price was pretty high, though. This ache is blinding.
I'm sorry to hear that, and will do all I can for you.
I suppose he's done me a favour, though. At least I won't have to go back to that hole for at least a few weeks.
That's right. Only lots of rest and recuperation is on the cards for you now. I'll put together a sick note to that effect so that you can send it in. I recommend at least 3 weeks. I'll also prescribe you with something for the pain you mentioned.
Thanks. I'm sure that after a few weeks, I'll be right as rain.
Question 26. You hear 2 dentists discussing their day. Now read the question.
You look exactly how I feel. Are you absolutely rushed off your feet too?
This day has been absolute chaos. We've got procedure running over the time that's been allocated, meaning that if the impacted procedures are going to take place, then they'll have to be moved to other rooms or even worse, other clinics.
I know, it's a nightmare. I'm not surprised that we've had patients calling in left, right and centre, demanding this and that. I really do take my hat off to HR and the receptionists who must be snowed under dealing with all of this.
Absolutely. I'm just doing my best to keep a low profile and stay out of the crosshairs, to be honest.
I hear you.
Question 27. You hear a patient and nurse talking about blood type. Now read the question.
You're going to think that I'm absolutely obsessed nurse, but blood really does freak me out.
No, that's something we'd have to have had requested from the start.
Yes, that's fine. Oh, will it tell me my blood type?
Why, is that something you'd like to know? 'Cause I can arrange to have it done. Okay, thank you. I'll let you know if I have any other questions.
Would that mean that you'd have to take my blood again?
Why, is that something you'd like to know? 'Cause I can arrange to have it done. I'm afraid so.
Oh, no thank you. I don't want to go through that again. Besides, I think it's likely that I'm an O.
What makes you think that?
My parents are both O's, and blood type's genetic. It's likely that I'm negative instead of positive, too.
You sound curious enough. Are you sure you wouldn't just rather find out for certain? I could have you seen ASAP if you want.
Question 28. You hear a hospital committee. Now read the question.
We've worked really hard in 2018, and we're looking forward to a productive 2019. In terms of our metrics this year, we've seen an increase in the number of facilities here, and thankfully, a decrease in the number of spontaneous sick days, or SSDs, in staff across the board. What we've not been able to master yet is the amount of negative feedback we've been receiving from service users. While most of it is about the food, which frankly is to be expected, let's make 2019 the year of fewer of these complaints, shall we? Thank you all for coming, and I look forward to seeing you again in the summer for our biannual review.
Question 29. You hear a conversation between a senior member of staff and a nurse.
Really sorry to bother you, but did you get my email?
Which email? The one about the beds or the lift?
So you got them?
Yes, I did. It's just taking me a bit longer than I'd hoped to deal with everything is all. But rest assured, I will.
Thanks.
Whilst I have your attention, though, you mentioned a problem with the lift, but didn't actually say what it was.
It's got an awful odour coming from it, and we're hoping that it'll be sorted. Patients are getting pretty rowdy about it, and we'd like that to stop. I thought it would be best to point it out ASAP.
No problem. We'll take care of it.
Question 30. You hear a vet presenting her findings on a new condition. Now read the question.
Today I'd like to issue a stern warning to local pet owners about the dangers of leaving compost caddies unattended. I'm currently working with an owner whose terriers fell really ill after getting access to and ingesting old potatoes. It seems that she and other pet owners had not really considered this a risk before this incident because it wasn't something that had ever happened before. My colleagues and I are investing in spreading awareness of new tech that will guard your compost caddies and keep your dogs out of harm's way. The Sea Caddy 3000 is a really smart bit of kit, and it's the first time this kind of technology has ever been marketed to pet owners. So I'm really excited to be one of the first vets to let you know about it.